Hey guys, what's going on? Quick question. What would you do if you or someone you know got their tooth knocked out? Like literally knocked straight out of your mouth, right in front of you. Yeah, I know it sounds very ridiculous, but accidents do happen and that's a fact of life, especially in dentistry. I have seen some cases where people would come with their tooth being broken or fractured or even have jaw fractures, and sometimes their tooth literally just came out of their socket. And of course, the first thing many persons would do is panic. And so in today's video, we are going to be talking about what you can do if this happens to you or someone you know. Stick around. Hey guys, what's up? Thanks for watching. If you're new here, I am David Adams, where my channel promotes a healthy body, healthy mind, healthy smile. In today's video, we are going to be discussing a topic that you don't really hear about in dentistry. We are talking about what you can do if you or someone you know got their tooth knocked out of their mouth. And in dentistry, we call this accident an avulsion. Just so you know, there's so many different accidents that can occur in dentistry. There's luxations, subluxations, there's fractures of the tooth, there's jaw fractures, and so many more. But today, we are discussing what you can do if your tooth gets completely knocked out of the socket. And like I said, this is called an avulsion in dentistry, when the tooth is displaced from the tooth socket and out of the mouth. If you are a Sunday school teacher, a school teacher, a parent, or anyone who is in contact with kids, I think you should watch this video because most accidents occur with children. And you will be the new superhero because you will essentially save that child's tooth. But before I go any further in this video, note is if there's any injury happening to your mouth, the first thing you should do is visit the dentist immediately. You don't go trying to do any magic on your own. You go to the dentist. There's so many different dentists here in Guyana. There's private dental clinics. There's the government dental school on Carmichael Street. You just check somebody out there. Don't do any magic on your own because you might cause more injury if you have an accident or if you have an avulsion happening. However, if the accident occurred in the night or on the weekends, where most times the clinics are closed, then this video can help you to save the tooth until you get to the dentist. And so the first thing that you need to do is one, of course, find the tooth. If the tooth gets knocked out of the mouth, find the tooth. And so now that you've located the tooth, the second thing you need to do is determine if it is a permanent tooth or a baby tooth. Permanent tooth, baby tooth, same thing. Now you should know that, as we grow, we usually would have our baby teeth. And then we lose our baby teeth. And then our baby teeth is replaced by our permanent teeth or your adult teeth. Remember, your baby tooth and your adult tooth, they look completely different. So when you're locating the tooth, determine if it's a permanent or a primary tooth. And usually the baby or primary tooth looks very white and they're usually smaller as compared to the adult tooth that is more larger and a little bit more cream or off-white. If you realize that, this is a baby tooth, then listen, you can't implant the tooth back again. Reason being is because in tooth development, beneath the baby tooth, there is the permanent tooth that is ready to emerge. And so if you implant the baby tooth back into the socket, you will cause damage to the underlying permanent tooth. So anytime the tooth is a baby tooth, a birth mission, do not re-implant. The third thing you need to do is to ensure that you pick the tooth up by its crown. The crown is the white part of the tooth. Now we know that the tooth has different parts. There's a crown that you usually would smile and see. Yeah, that's the crown. Beneath the crown, there is the root that you don't normally see. That is embedded in the tooth socket or the bone. And then of course, there's the pulp and a whole bunch of other things that we won't get into today. So what you'll do is hold the tooth by the crown and not the root. Try as hard as possible to not touch the root after you find it on the ground. Now mind you, of course, if the tooth came out of the mouth, went to the ground, chances are that there will be dirt and sand and a bunch of different things on the tooth. And it also might be bloody as well. And so in those cases, what you will do is rinse the tooth quickly in some water and then reposition back the tooth. Take the tooth by the crown and put it back into the socket where it came out of. In repositioning the tooth, ensure that the tooth is in line with the others, ensure it's turned properly, and ensure it is seated in the socket correctly. If you're not confident in doing this, then okay, that's fine. You need to go to the dentist immediately. However, if you can't get to the dentist immediately, then you need to store the tooth properly. On your way to the dentist, there's different ways you can store the tooth. One, you can get a glass of milk and store the tooth in a glass of milk. Yes, a glass of milk. This helps to preserve the cells that are around the tooth structure, the tooth root rather, and it helps with better reimplantation into the socket when you get to the dentist. If you're wondering what type of milk to use, full cream, whole milk cream, skim milk, it doesn't matter. Just don't store it in almond milk because that thing is nasty. Like, damn. Just don't store it in almond milk. Of course, sometimes the accident does not occur at home or any area where there is milk. And of course, you will have to use another storage medium. But if there is no milk, your next storage medium is going to be in the person's mouth. Yes. Take the tooth and store it in the person's mouth. Yeah. I know it sounds nasty, but it's perfectly fine. It's your tooth. You take the tooth and you put the tooth at the side of the other teeth in the cheek area. Keep it there safe until you get to the dentist. And please ensure it is the same mouth that the tooth came out of and nobody else's mouth. Just saying. If the patient is a very young child, then of course, do not store the tooth in the patient's mouth because children will tend to swallow it and cause more accidents, and we don't want that. And you're not gonna say, I say, store it in the mouth of a child. Store it if it is a very mature person. If the patient cannot keep the tooth in their mouth, then what you're gonna do is ask them to spit into a container. Yes. Take their saliva, put it into a container, and then store the tooth in that saliva until you get to the dentist. And lastly, whatever you do, do not store it in water. That's the first thing that many persons will think about. Water will cause the cells around the tooth to get very turgid or swell, and of course that will interfere with the reimplantation of the tooth. And then before you know it, the tooth might just fall out and you will have to wear dentures, or you will have to put in some implants because you stored in water. If you follow these steps or you would have stored the tooth correctly, then chances are you will save your tooth. But after avulsions, most of the time, years pass, and what happens is that the tooth becomes discolored, and as such, a root canal will have to be done later on in life. So just watch out for that. Most times after an avulsion, the patient has to do a root canal once the tooth is reimplanted. Thank you guys so much for watching. I really hope that you learned something in this video and that you will know what to do the next time, or if an issue like this occurs with you or with someone you know. I am David Adams, where my channel promotes a healthy body, healthy mind, healthy smile. Remember to comment, like, subscribe, and share. And as always, this room is sponsored by Solas Guyana Inc., my favorite place. I just love Solas Guyana because their atmosphere is just beautiful. You have access to so many things: Wi-Fi, AC, my lovely coffee, and so much more. If you're looking to shoot videos, if you're looking to have small meetings, if you're looking to have a room for a month or 2 months or what have you, you can contact them. I'll leave the number here, or you can email them and ask them for their packages. In this time of coronavirus, remember to mask up, take the vaccine if you can, protect yourself, wash your hands, and just stay healthy. And as always, remember to stay happy, stay healthy, brush twice a day, and floss daily. Bye for now.